Hi there. This is Meggan Eldredge, the Health Director for the Town of Harwich, with a COVID-19 vaccine update. As you know, the Department of Public Health has a vaccine distribution plan that consists of 3 phases. We're currently in phase 1 of this distribution plan. The groups within these phases are prioritized depending on their risk of contracting and getting sick from COVID-19. We have a phase 1 is happening right now. It started in late December and included COVID-facing healthcare workers, long-term care facilities, and first responders, including police and fire, and harbor masters, Coast Guard, and all those other types of first responders. And we are currently in the middle of phase 1, which starting next week, we anticipate being able to vaccinate congregate care settings, corrections, and shelters. After that, we move to the next priority group within phase 1, and that includes home-based healthcare workers. These healthcare workers include professionals who work with medically complex individuals within their homes, PTs, OTs, and speech therapists, personal care attendants, home health, hospice, and home care agency staff performing visits at home, independent nurses and skilled nursing staff that go into people's homes, aging service agency staff performing regular visits in the home, and other professionals that do home-based healthcare work. Individuals who do not come into contact with patients, such as remote office workers, are not eligible in this next priority group. Once that priority group is underway and we are ready to do the next priority group within phase 1, which is scheduled to begin the beginning of February. That group includes healthcare workers that are not COVID facing, which include dentists, dental care, medical and nursing students, inpatient and outpatient physical therapists, interpreters who work in hospitals, behavioral health clinicians, and other professionals that work in laboratories and dialysis centers. Speech and audiologists, pathologists are able to be included in the next phase of phase 1, the next group of phase 1. Phase 1 eligibility is listed on the mass.gov website, and that is your best source of information for up-to-date eligibility criteria, whether you are or are not included in the current phase. On that website, there is a link to a map of sites that you can get vaccinated if you are currently eligible recipients. This map is on the screen right now, and as you can see, there are 3 different color stars. The purple ones are private pharmacies that are offering vaccinations for COVID-19. The red star is Gillette Stadium. That is a mass vaccination site. Anyone in the Commonwealth who is currently eligible for a vaccine is able to go to that site. And the green sites are smaller, more concentrated sites that you require either residency or proper identification to get into. One thing to remember about these vaccination sites now and going forward is that pre-registration is required. You cannot just show up to these vaccination sites. You do have to register, whether it's through an online system or a telephone system. Each star on the map has a link to how you can sign up for these sites. When you arrive at the sites, you are required to bring proper identification to ensure that you indeed meet the eligibility criteria. Signing up does not require a checkbox of any sort, but when you arrive to that site, you are going to need to show some type of identification. Once phase 1 is underway and nearly complete, it's important to know if you are in phase 1, you will always be eligible for vaccines going forward. So if you're in one of these groups and you missed your opportunity before we moved on to the next group, you're still eligible. Phase 2 is scheduled to start in February. It is a more widespread population that is eligible for vaccine. The first bulleted group, the first priority group that will be taken care of in phase 2 includes people with 2 or more comorbidities, which I'll go over soon, people who are age 75 and older, and people who are living in private and public low-income and affordable senior housing. Taking care of these individuals through clinics will happen in a multitude of ways. There will be sites on a map that we saw for phase 1. There will be targeted clinics for senior housing. There will be drive-through clinics offered by the town. And there will be regional clinics offered by Barnstable County, as well as other private agencies. Clinics will also be pre-registration only. The instructions for getting into one of these clinics right now are still being determined. I have met with Council on Aging and our town nurse, the other health agents in the region, and we are planning on a variety of clinics to serve all of the people that are within this first bulleted priority group. Communication of the eligibility and the locations and how to sign up for these will be widespread. There will be a robocall, there will be a newspaper posting, there'll be information on the website and in all of our social media sites as well. You will not miss the opportunity to get vaccinated because of lack of communication. We will get the word out. This is current information, and calling the health department for more information at this time is not going to give you any more information. Unfortunately, we don't have anything else to tell you about that at this time. So check our website, check the county website, check the state website, and these updates are made at least weekly. Once this first bulleted group of priority in phase 2 have been vaccinated, which I said was February to March, we will move into the next bulleted groups of phase 2, which include other workers such as K through 12, early education staff, grocery store workers, utility workers, restaurant workers, employees in the food and beverage industry, retail workers. It's a very broad group. And these are people who are working in industries where they are often in contact with other people, people that may have COVID-19. Once that group is complete, we will be going into the next bulleted phase, which is adults 65 and older, and then individuals with one comorbid condition. This phase is going to be completed over the course of a couple of months. There is not a shortage of vaccine. We are just prioritizing groups and making sure that we can vaccinate everyone in a priority manner. All of these shots right now require a second dose. One is 3 weeks after the first, and the next is 28 days after the first dose. When you get your first dose, make sure to sign up to get your second dose. It's important to know that one dose of this vaccine is not effective. You do need 2 doses of the Pfizer and the Moderna vaccine. And lastly on this, comorbid conditions. As I said, in the first part of phase 2, you are eligible if you have 2 or more of these conditions, which consider you to be at a higher risk of illness from getting COVID-19. Cancer, chronic kidney disease, COPD, Down syndrome, heart conditions such as heart failure, coronary artery disease, or cardiomyopathies, immunocompromised state from solid organ transplant, obesity with a body mass index of 30 or more, or severe obesity, which is a BMI of 40 or more, pregnancy, sickle cell disease, smoking, or type 2 diabetes. Other conditions that might increase your risk, which are included as comorbidities, are asthma, cerebrovascular disease, cystic fibrosis, hypertension or high blood pressure, immunocompromised state from blood or bone marrow transplant, immune deficiencies, HIV, or use of corticosteroids or use of other immune weakening medicines, neurological conditions such as dementia, liver disease, being overweight with a BMI of 25 or more, pulmonary fibrosis, or type 1 diabetes. It's important to know that we will all be able to access the vaccine. Getting on a list for a vaccine isn't how we are doing it at this time. It is wait until your eligible group is called upon, and that is when you're able to sign up for a shot through a website or a site, and those will be listed on mass.gov as well as the Town of Harwich website. Other vaccine information or general information about COVID-19 can be found by calling the county website, the county hotline. They have a hotline that is available, and we will get the phone number listed on our website. It is open Monday through Friday from 8:30 to 4:30, and there are MRC volunteers that answer the phone, and if you get a voicemail, leave a message and you'll get a call back. They're able to answer questions regarding the disease, the vaccine, questions about what to do if you are sick, if you're worried about being sick, where to get the vaccine, and other general COVID information. So we'll get that information, the phone number listed for you. And that's all I have for the vaccine update. And as I said, check back with the website frequently for updates. Thank you.